Thank you very much for inviting me here today. As Phil said, I'm primarily a public health and specifically alcohol researcher. So I'm going to be talking to you about alcohol primarily, but I'm going to also try and link that to kind of wider behaviours. So I'm going to start off by talking about the polarisation that both Phil and Tony have mentioned. And I'm also going to try and dig down into those trends as well and talk about differences in socio-demographic groups. So if we start off by talking about the trends in lockdown, so there has recently been a paper, which I don't think has been published yet, but I saw at a conference, which focuses on Europe generally. So it's a huge survey, the European COVID-19 and alcohol survey. So there's 32,000 drinkers in that, and that was conducted between April and July. And it looks at alcohol consumption during lockdown across 21 European countries. On the whole, so in 20 of those countries, we see reductions in alcohol consumption. In one, guess which one, we do see, as well as some decreases, we do see some increases as well. So the UK was the only country where a significant increase was reported in alcohol consumption. And the author was speculating about possible reasons why this might be. So one of them was that alcohol was always and is always available in the UK throughout the lockdown period, and that wasn't the case in all of the countries. And one other explanation is that possibly we have a different relationship or a different culture in regard to alcohol in the UK in relative to other countries. So I'm going to focus on talking about the UK today because that's what I know about, so it seems like a sensible place to start. So in the UK specifically, during lockdown, we see about 50% of people who just drank the same all the way through, so before and after. We see about 25% who drank less during lockdown, and we see about 25% who actually started drinking more in lockdown. So one possible reason and explanation for this is that we're all currently living through a very stressful time in different ways, I'm sure, but I think most people would say it's not been easy over the last 6 months. And we actually know that from previous research that people respond to stress in different ways in terms of their drinking behaviour. So for some, stress motivates them to make changes, to cut down and to try and improve their health. And for others, they tend to drink maladaptively as a coping strategy, and they actually drink more. So we've got some data where we've examined the link between stress and alcohol consumption in lockdown. And we found that increased stress was linked to both drinking less for some people and to drinking more for others. So stress about catching COVID, about becoming seriously ill, and also with regards to finances, were all associated with drinking more than usual, which is, I said before, is kind of in line with this idea that for some people, stress is a risk factor for maladaptive drinking or excessive drinking. And then on the other hand, for some people, stress about becoming seriously ill from COVID was actually associated with drinking less than usual. So that could be due to people kind of trying to boost their health, or it could also be linked to financial concerns as well. So for the rest of this talk, I'm going to try and dig down into these findings. I'm going to talk about some of the groups who we know are drinking more in lockdown, and some of the groups that we know are drinking less, and try and consider why that might be happening, why people might be differentially affected. So if we first off, I'd like to focus on this 25% of people who we know are drinking more. So this matters because, as we know, there are many negative health and social outcomes associated with alcohol consumption. So that includes hospitalizations, domestic violence, and many health conditions, both in terms of physical and mental health conditions. And at the moment, drinking to excess or drinking to drunkenness is particularly worrying because it could affect and is likely to affect kind of adherence to these protective behaviours, which are necessary in order to kind of spread, keep the curve spread and to ensure that rates of virus stay low. Sorry about that. So a few papers that we've been working on at the moment are looking at who's drinking more in response to lockdown. So some of the things that have been found to be associated with increases in consumption during lockdown are, as Tony and Phil said before, being a heavier drinker at baseline. So those who drank more before do seem to be kind of increasing and drinking more in lockdown. Being younger, being female, having an annual household income of over £30,000, and being stressed about becoming ill or catching COVID are all associated with increases in drinking, as was being furloughed from work, which is perhaps unsurprising, just due to complete changes in lifestyle, I suppose, and for some boredom, I would have thought. In terms of other kind of mental health conditions, so having a diagnosed anxiety disorder was also associated with drinking more than usual. And it's possible that, again, this is due to some kind of maladaptive coping mechanism. So people are trying to control their anxiety and trying and make themselves feel better about the current situation. And that fits with some of the data where we see that the reasons that people give for drinking more in lockdown are often reported as being due to worry or stress and depression. So this altogether might mean that people drinking more are generally doing that as a kind of a maladaptive coping mechanism and a response to the stress that they're experiencing. So those studies that I've talked about up until now, they focus on kind of drinking overall. One thing which is quite important, particularly with alcohol, is to consider different patterns of drinking, because we know different patterns of drinking are differentially related to harms. So for example, heavy episodic drinking or binge drinking, which is defined as drinking more than 6 units per occasion, is particularly harmful, both in terms of kind of physical and mental health conditions that I was talking about before. And as I said before, is also particularly dangerous at the moment because of those kind of, those adherence to those behaviours that we know are important, social distancing, etc. So when we look specifically at heavy episodic drinking, we see increases amongst women, and that's particularly amongst younger women who live alone, who have been furloughed or a key worker, or have experienced reductions in financial circumstances or their psychological well-being. So what I'd like to do next is to kind of choose a couple of groups who we know are drinking more and consider why that might be. So as I've kind of said up until now, overall, we know that women are actually more likely to report drinking more than usual during lockdown, and actually men are more likely to report drinking less. So if we think about why that might be, so why are women drinking more during lockdown? One possible explanation is because they've been worse affected by lockdown, and this does seem to be borne out by a lot of the data that we're seeing. So lockdown appears to have increased gender inequalities in both paid and unpaid work, with women more likely than men to have lost their jobs, to have been furloughed, and also to be carrying the burdens of kind of those increased domestic duties, both in terms of caring for children, elderly relatives, but also in terms of doing housework, or the additional housework that I'm sure we are all experiencing is necessary when you're home all the time. So yeah, there's kind of that side of it, and there's also data which suggests that actually women are also experiencing more psychological distress as a result of lockdown, and those two things are obviously linked in terms of kind of the additional strains and stresses. But women also report having much lower kind of quality of life and well-being. They're much more likely than men to be reporting additional anxiety and depression in lockdown, as well as lower life satisfaction, and increased loneliness as well, which seems to be a big factor in terms of those drinking more. Another group who we know are drinking more are younger people. So age is actually a really interesting one, because it seems that young people are both likely to be drinking more and also likely to be drinking less, depending on the groups that you speak to. So as Tony was saying before lockdown, youth drinking was actually declining and has been for the last 20 years. So that's amongst children, so kind of teenagers, but also amongst young adults as well. So it's really interesting, I think, that we're actually seeing this polarizing effect now. So where some people are kind of carrying on with those trends and actually drinking even less, we do have this group who are actually starting to drink a lot more. So if we think about those who are drinking more first, it could be, again, because those younger people have been more affected by lockdown in some ways. So it's possible that younger people are more likely to be in kind of less secure working environments, particularly kind of teenagers and the younger adults. So they might have kind of more concerns about their future job prospects in terms of younger people who are going to university and dealing with education. There's been a lot of uncertainty in terms of exams, in terms of what that's going to look like and what their future is going to be. Also, again, if we consider kind of psychological well-being, it does seem that younger people have been at least from the data we have up until now, have been worse affected. So again, they're more likely to report anxiety and depression. They're more likely to report having much higher loneliness and lower life satisfaction. And as I said before, they also have these additional concerns about the impact of lockdown on their future a little bit more, because they don't know where they're going to be and what it's going to mean for them. They're less likely to be in stable kind of environments and stable relationships. But as I said before, there's some data as well which suggests that actually there are changes in the opposite direction as well. So some younger people are drinking less than usual. And when we think about why that might be, it could be in terms of thinking about the context in which people usually drink. So younger people are much more likely to drink in on-trade locations. So when I talk about on-trade locations, that's kind of pubs and bars, and older age groups are more likely to drink at home. So it's possible that actually less exposure to those kind of traditional drinking cues for young people, such as being in the pub or being with friends who they might usually go out and have a few pints with, might mean that they're actually less likely to drink overall. Whereas kind of that closure of these on-trade drinking locations might have affected middle-aged people less, because they were less likely to drink in those contexts in the first place, or at least less likely to drink exclusively in those contexts. So this takes us quite nicely into considering who is drinking less in lockdown. So those of Black or Asian minority ethnic backgrounds were more likely than those of white ethnicity to be drinking less than they usually would. So there's been quite clear evidence now that COVID-19 does not affect all groups equally, and minority ethnic groups have a greater rate of infection. They're more likely to experience severe symptoms and also have higher rates of death as well. So it's possibly that there's actually kind of greater health-related concerns amongst these groups, and sort of more general health concerns in the context of the pandemic altogether. So it's possible that people are kind of more likely to reduce their alcohol consumption in these groups in some attempt to stave that off and to protect their health. This is in line with other data which shows, generally speaking, that those who are more concerned about COVID-19, particularly catching it, are more likely to be drinking less. And then finally, we do also see that drinkers of a lower socioeconomic position, so that's indicated by income, were more likely to be drinking less than usual. So this is kind of true before lockdown as well, is people of a lower socioeconomic position drink less frequently than those of higher economic position, and that's possibly something to do with, you know, disposable income. It's also, if in terms of if we're thinking about particularly that kind of earlier period of lockdown, it's possible and quite likely that those of lower socioeconomic position had a completely different experience to those of higher. So they're much more likely to have been isolated in less comfortable or less spacious living conditions. They're less likely to have outdoor space in which to kind of relax or to exercise. And I think that's particularly true when we weren't allowed to go to the parks. And I think, speaking as someone with no outdoor space, that was very challenging in those early lockdown periods. And they're also, of course, more likely to have financial concerns as well, and financial stresses, which could lead to greater consumption. So taken together, these studies seem to show that as a country, we have fairly unique attitudes to alcohol in the pandemic. So we know that there has been polarization in drinking behaviours, with about a quarter of people drinking more and a quarter drinking less. We know that stress often has this polarizing impact on alcohol consumption, and that it leads to some people drinking more and others abstaining altogether. So those increase in their drinking seems to be women and young people in particular. And this does seem to be in part due to them experiencing particularly poor mental health in response to lockdown. Alternatively, those from Black and Asian minority ethnic backgrounds and those of lower socioeconomic position are more likely to be drinking less. And this might be due to greater health-related anxiety in forms of contracting the virus, or due to greater stress caused by disparities in financial and living conditions. So I just wanted to finish by kind of stressing that going forwards, it's really important to consider that we're not all affected by COVID-19 and different levels of lockdown in the same way, and that needs to start to be really considered with regards to policy and support options. And I just wanted to finish with a quote I saw recently from Damien Burr, which was that contrary to the almost constant messaging from the government that we're all in the same boat, rather we're all in the same storm, but some are on super yachts and some have just one oar. So I think that's something that we all need to start realising a little bit more, myself included.
Thank you very much for that, Melissa. That was very enlightening, and a rather bleak but also very informative image you conjured up at the end there. There's in the UK, there are people from elsewhere in the world, but in the UK we had this kind of period in which pubs were closed for a while, and then they've reopened, and then they're now sort of half open, half shut, so we're not quite sure. But you mentioned that particularly for younger people, this may have had an effect on their drinking. Could you say, is there sort of justification for the pub closure in terms of actually sort of minimising, the impact of COVID, and what effect will this, sort of half measure what impact might that have on youth drinking now?
So I think one thing which is interesting is with everything there's kind of these two sides, but I do think this particular policy may not have been all that well thought out, because I think although there is kind of the benefit of limiting the drinking, so we know that when people are drunk, they're much less likely to stick to those social distancing measures, they're much less likely to stick to the protective measures in terms of wearing masks, washing their hands, staying away from people. So I do understand kind of this drive towards trying to limit public drunkenness in those wide open spaces where there's lots of people. But I've seen recently as well that actually having this kind of one time where everything shuts, what you actually see is then everyone pouring out onto the streets at the same time. And essentially, I mean, I'm in London at the moment, and central London then is busier than it has been at any point. So it's difficult really to kind of say what those longer term effects are going to be. I do think that based on sort of the coverage you see, it does seem to be more young people who are actually in the pubs at the moment, and speaking to people working in those areas, it does seem that it's mainly younger people who are going to those spaces, particularly pubs. Restaurants is perhaps a little bit more split, but until we have the data, that's just speculation from me. We don't really know.
Mm-hmm. And you mentioned that there's, we're not just talking about alcohol, we're talking alcohol plus a kind of environmental effect that this COVID is having on different groups of people, and women and young people having a different experience to men, simply because of the different sort of roles they play in the world. I mean, what kind of mental health issues are arising as a result of COVID? Is there any sort of pattern to what's happening?
I think certainly the kind of social isolation elements that were definitely prevalent early on were leading to kind of a lot of loneliness, to a lot of depression. I think kind of this state of kind of constant vigilance that has been encouraged is leading to a lot more anxiety, particularly amongst those who already suffered from anxiety, and particularly with those with health-related anxiety. And like I said before, it's those groups who are particularly at risk, so older people and also people from BAME backgrounds. I think it's kind of that times 10 really, which is a worry. And I don't think there's been a huge kind of push to address that disparity in terms of the support that's available at the moment.
There's a difference in the way that drinking patterns are evolving. I think Tony has mentioned about how baby boomers are still sort of partying like it was 1968 in some circumstances. And whereas younger people, in terms of their alcohol consumption at least, are actually a bit of an example to us all in how maybe to lead our lives. Is there any evidence of what they're doing instead? I mean, not just now, but maybe what is there out there beyond drinking, and why are they not participating in this revelry that older generations have done?
So everyone always assumes it's drugs. It's so cynical. But actually, when we look at kind of the levels of reported drug use as well, in terms of cannabis in particular, which is kind of the most prevalent drug that's used amongst young people, but also in terms of stimulants like ecstasy and cocaine, actually what we see is drops in those as well. So it's not that we're saying that no young people are drinking, no young people are taking drugs. Obviously they are, and that's something that we all see. But if you look at that in terms of historical trends, they're doing that less than young people were 10, 20 years ago. Some of the kind of reasons that seem to be coming out, so there's a project I used to work on which looked at exactly this, and it's early days, so we don't have all the answers yet, but some of the things that seem to be coming out is that people kind of value different things now. So alcohol doesn't have this kind of central role in young people's lives, and it's not kind of the focus of an event. There is kind of this move amongst young people towards go hard or go home. So they're drinking less overall, but actually when they are drinking, they really go for it. And it's possible that that's to do with kind of, you know, in that situation, they deem the hangover worth it, or they deem the money worth it. So I think it's kind of about less about moderation and more about kind of special occasions or blowing off steam potentially when they do drink now.